Welcome back, viewers, to Faith and Discipline podcast. Our topic today is diabetes, and our guest is Dr. Inam Khan, who is consultant diabetologist in the UK. Welcome, Dr. Khan, to our show.
Thank you so much for inviting me for your podcast.
Let's start. Our first question is, what is diabetes and what are the symptoms?
So diabetes is a very common condition in which the blood sugar levels go extremely high, and due to that it has got effects on the body and can cause a lot of complications and problems to the patients. There are different types of diabetes, type 1 diabetes, type 2 diabetes, which are more commonly known in general population, but also there are some different rarer forms of diabetes which have got some genetic reasons for it, and there's also another type of diabetes which happens mainly in adults.
Right, okay, so we hear a terminology, insulin resistance. What is insulin resistance, and does it play a role in becoming diabetic?
Yes, it does. So let's just first of all understand the mechanism of insulin. So what insulin does is that it is a very common hormone which is being produced by beta cells in the pancreas. What insulin does is that whenever we eat something, mainly carbohydrates, when they go into the bloodstream, insulin is released, and it makes it go inside the body tissues, such as muscles more commonly, and it is converted into energy, and that's how human body gets energy. Carbohydrates is one of the main sources of energy. Due to unhealthy lifestyle or some genetic predisposition and some other factors as well, whatever insulin is being produced does not have its effect as it used to before, and also the body reacts differently to the same amount of insulin. Hence, whatever insulin which was sufficient before is not sufficient to push that sugar into the tissues and have its effect. And this is a phenomena which happens mainly in the later stages of type 2 diabetes, and in those situations patient would require insulin from outside.
If we say type 2 diabetes is purely lifestyle based, so is it true?
Most of it, but patients who have got a family history of diabetes has got its effect as well. So there is some genetic causes for that as well. But it's mainly the lifestyle that have got a major role to play in the development of type 2 diabetes.
So general public don't really understand what is the difference between type 1 and type 2. They believe it's the same thing. Can you please tell us a bit more about what's the main difference?
Yeah, of course. So type 1 diabetes is mainly caused by the antibody reaction against the beta cells of the pancreas. Beta cells slowly and gradually destroyed, and their population is reduced, which leads to development of type 1 diabetes. It mainly occurs in younger children and young adults, and it happens quite quickly in the matter of few weeks or months. And majority of the symptoms of diabetes a person can have when they develop type 1 diabetes. Type 2 diabetes is different. It's more prevalent. Almost 90% of the patients living with diabetes are type 2 diabetes. As I mentioned before regarding insulin resistance, insulin is still being produced by pancreas, but slowly and gradually it does not have that effect, and the blood sugar levels keep on going high.
How big is the problem if we look at the general population? Can we say it's next pandemic?
I think you're right. Diabetes is one of the most rapidly rising problem in the whole world. Around more than 4 million people in the UK are living with diabetes, and it's extremely big number, yes. And it is estimated that more than 850,000 people are living with diabetes, but they don't know about it.
So if they don't know about it, do they still feel any symptoms? Something is wrong with them?
Well, if the sugars are only borderline high, then a person may not be aware of the fact that they have got diabetes. It's only when the sugar levels are extremely high, they can have some symptoms such as they feel thirsty all the time, they pass too much urine, In later stages, they can lose weight as well. They get tired and weak, and these are the most common symptoms of type 2 diabetes.
Whether they know or they don't know doesn't make much difference, because their body is going through all those changes, and the diabetes is damaging their body, unfortunately, isn't it?
That's correct, and that's why it's called a silent killer as well, because people will be having diabetes for a long period of time, and it slowly and gradually damages their eyes, their kidneys, and the nerves which supplies their hands or feet, and they're not fully aware of it.
So statistically, if we look at it, then what does number say? Is a young population biggest victim, or is the older population?
Type 1 diabetes is more common in the younger population, and type 2 in older population, but that has been a general concept. Our lifestyle is changing quite rapidly, and depending on our food choices and very busy lifestyle, there is an increasing number of younger people also developing type 2 diabetes. Traditionally, it was thought that people who are more than 40 years of age are prone to get type 2 diabetes, but we are increasingly seeing a younger population in their 20s who have been diagnosed with having type 2 diabetes.
That seems quite dangerous for a young population to becoming victim of a disease which they have to manage for the rest of their life. So what do you reckon, what is the reason why it's increasing in younger population and especially in children?
As mentioned before, it's mainly the lifestyle changes. We are depending mainly on the processed foods, fast foods, which has got a lot of carbohydrate and fat content, which puts a lot of pressure on pancreas to produce insulin all the time, and there's a constant battle going on, keep that blood that sugars into the cells, and ultimately pancreas just gives up. It can't just do it anymore. And that's why at a very young age people develop type 2 diabetes.
So if there's a big number of children who are becoming victim of this disease, what parents can do to stop this, stop their children becoming victim of this?
I think lifestyle changes is the key here. We have to educate our younger children to choose healthy food. We need to feed them a balanced, healthy diet which has got good quality of carbohydrates, fat and protein content. We also have to make sure that they are physically active, which is extremely important. So these are the common steps that we can take to prevent it from happening.
Okay. If someone feels like they might be tired, they are thirsty, they are passing too much urine, what diagnostic tests they can go through to get it confirmed whether they are diabetic or not?
A very common test called HbA1c or hemoglobin A1c is done very routinely to check whether somebody is at risk of developing diabetes or is having diabetes.
So you just mentioned HbA1c. So how often does it need to be tested, and what is the normal range?
So the normal range for the cutoff to diagnose diabetes is 48 millimoles per mole. In between 42 to 48, that is a condition called prediabetes or non-diabetic hyperglycemia, in which patients are not diagnosed with diabetes, but they are at a risk of developing diabetes. After the age of 40, in UK, there is a general health check done, which includes checking HbA1c, cholesterol levels, kidney function test, liver function test, and if somebody is at risk of developing diabetes, then it should be checked every 6 months.
Which body organs get affected by diabetes, and what patients can do to prevent this damage?
Effectively, every organ in the human body, every system in the human body is affected with diabetes. More commonly, we divide the complications into two main categories, and these are called microvascular complication and macrovascular complications. Microvascular complications include damage to the eyes, damage to the kidneys, and to the nerves which supply the feet and hands. Among the macrovascular complications, diabetes can affect heart and can put people at risk of developing heart attacks. It also can cause strokes or mini strokes as well.
Which is the biggest culprit in becoming a victim of diabetes? Is it food, unhealthy food, or inactive lifestyle?
I think both of them have got this effect. How a person would lead their lifestyle, which include diet, which is, I think, is the most important factor in developing of diabetes. It also includes sedentary lifestyle as well. Smoking, as I mentioned before, genetic predisposition has got its role to play as well. So what we commonly say that it's nature or nurture.
Okay.
So the lifestyle choices that we make all comes in under the banner of nurture. But it's mainly the nurture, the lifestyle modifications have got a key role to play in the development of diabetes.
Right. So another question regarding the same topic, we are talking about food, unhealthy food, or inactive lifestyle. Quite easy, like for children to reach out for unhealthy food because it tastes really good, and they can't resist that food. What parents can do to help their children so they can encourage them to go for a healthy lifestyle rather than go for unhealthy lifestyle?
I think the best approach is that we have to reward our children for their efforts regarding their food choices. So what I practice and also tell my patients is that they would have to make very strict routine of adhering to a balanced diet, which we can adopt as well to our children. Is that let's say that throughout the whole week we feed them home cooked meals mainly. Let's say at the end of the week we can just reward them with whatever food they like. So in that situation they can stay away from that unhealthy junk food for majority of the week, and once in a while they can enjoy whatever they eat. So in that situation, I think that is a win-win situation for us.
Yeah, that's not bad. That's a good advice. So if someone becomes diabetic, and what is the treatment of type 1 and type 2? Is it the same treatment, metformin and insulin, or is there any difference?
It is different. Type 1 diabetes is treated with insulin only because the beta cells of pancreas do not produce insulin anymore. So we just give them insulin and that is their treatment. In type 2 diabetes, we start with the tablets and we have got a pattern to follow. Let's say metformin, and there are some other newer medications available as well, such as SGLT2 inhibitors, gliptins, sulfonylureas, and then we have got GLP-1 agonist treatment, which is a newer form of diabetes treatment, and they come in tablets and injections as well. All these treatment options are obviously different to insulin, and we try to keep the HbA1c into an acceptable range with the help of these treatments. But if it keeps on going high and diabetes remain uncontrolled, then we have to go on to insulin in type 2 diabetes patients as well.
Is it possible for the patient to pick which treatment works for them? Like if they want to pick, like I want to take metformin, while others say, no, I want to go directly on insulin. Is there something possibility for patient to pick themselves, or is it the physician they decide?
So I think our role as a physician is to provide all these options and choices to the patients, and ultimately, obviously, it's a patient choice about these medications. Since diabetes is a long-term condition, and a physician-patient relationship is extremely important in that regard. So what I do in my practice is that I provide them with options, the most common ones, treatment options which do not have much side effects as well, and it's tailored to a patient need as well. And then most of our patients, obviously, they trust us, and then they go with whatever we advise them.
What are the serious health conditions which are linked to diabetes? As you mentioned before, a high blood glucose level, it affects eyes and kidneys and hands and feet. So how bad it can become?
Diabetes is one of the most common reasons for morbidity in patients. Eye complications are the first one to appear. It can lead to blindness. It's very common if the diabetes remains uncontrolled. Kidney failure is also a very common and very important complication, and patients end up on dialysis. The nerves, then they do not get sensations in their feet, which put them at risk of developing infections, and those infections are very hard to treat because diabetes affects the body's immune system as well in fighting those infections. So they need prolonged courses of antibiotics to be treated, and if the infection doesn't get treated, then it can lead to amputation of their feet and leg as well.
Quite scary thing to deal with, and obviously people need to look after themselves. We talk about hyperglycemia, which is like high glucose level, but some people suffer from hypoglycemia, which is low glucose level. So which is more dangerous, and what is the reason?
Undoubtedly, hypoglycemia is a more serious complication of diabetes as compared to hyperglycemia, because when the blood sugars are low, then it can affect a patient's conscious level. If they drop down to a dangerous level, then they can get confused, they can get unconscious, because glucose is the main fuel for brain, and if the brain does not get enough glucose, then it can lead to irreversible brain injury. Hence, whenever we are treating diabetes, we make sure that we provide enough education to our patients about hypoglycemia, how to prevent that, how to identify that their blood sugars levels are low, and how to treat them effectively.
What is your recommendation for people who want to fast? Is it safe to fast while someone is diabetic?
Absolutely safe to fast, especially in type 2 diabetes patients. We change their diabetes treatment. It depends on whatever medication they are on. We just advise them as to when to take those medications at sahur time, at iftar time. Their blood sugars are better controlled during the Ramadan anyways. Okay. So in that situations, we actually reduce the doses of their medications, and there is a lot of material available online now, and different trusts all over the country, they have got a very informative material for patients of diabetes who are actually trying to fast.
Okay, that's good information and a peace of mind for those people who want to fast. Like if someone start developing any symptoms for pre-diabetic and they want to look after themselves, so which foods they need to avoid in particular?
Glycemic index is a terminology that we use in describing different types of foods. High glycemic index food are a type of the foods which actually when we eat, the glucose get absorbed very rapidly into the bloodstream and will lead to high insulin levels straight away, and if that persists for a long period of time, then patients can have at risk of developing diabetes. So we should be aiming for a low glycemic index food, in which the glucose levels slowly and gradually rise in the blood, leading to a sustained release of insulin from pancreas, and that's what I think is important, and it prevents those insulin surge, which is one of the reasons for developing insulin resistance in long term.
So what are your overall recommendation for everyone, whether the person is diabetic or non-diabetic? They are quite healthy, but what is your recommendation? How can they prevent themselves from becoming diabetic?
So as I've mentioned before, that the lifestyle choices are extremely important. We have to look after our diet. We have to be physically active. We need to avoid all kind of unhealthy lifestyle measures to to prevent this from happening, we have to look after our weight as well.
Mainly we are talking about it should be within healthy BMI scale, around
Yes.
25.
Yes, and also it's one thing I forgot to mention is the ethnicity as well.
Okay.
So there are certain ethnic population which are high risk of developing diabetes, such as Asians,
South Asian.
African, Caribbean as
Yeah.
well. They are high risk of developing diabetes.
Mm.
So their BMI targets are different
Okay.
to Caucasians. There was a recent study which came up, I think last year, which was one of the biggest of its kind, and they actually compared the BMIs of different ethnic population, and for if I remember correctly, the BMI target for Asians was 22.
22 or 25. Okay.
Exactly. So that is one of the difference. So it means that the higher BMI is, they are more prone to develop all these complications, heart attacks, strokes.
Okay. Thank you very much for your recommendations. If someone wants to just pick one thing and want to make the change, in their life, what do you suggest what that should be?
I would certainly pick diet modification as the most important factor, because there is evidence behind that as well, is that if we control our diet, which is, again, you're absolutely right, is one of the most difficult thing to do in day to day, but I would suggest that diet is one of the most important factor.
Thank you very much, Dr. Khan, for joining us today. Your advice and recommendations were very useful, and I hope it will help a lot of people. Thank you very much.
Thank you so much for having me.
This is the end of today's topic. If you haven't already, make sure to subscribe and share with your family and friends. If you need help with the diagnosis of any of the diseases, you can ask questions in the comment section. In near future, we are planning to do our podcast live. Consultants from different specialties will join me and try to answer your question and try to help you with your diagnosis and your treatment. Thank you very much.